let's start with a really big question. How deep is the connection between what you eat and how you feel? Really? I mean, we all talk about food for our physical health, right? But what if it's one of the most powerful tools we have for our mental health, too? Today, we are diving into a whole new field called metabolic psychiatry, and it's built on a pretty radical idea that the root of many mental health issues might not just be in our heads, but actually on our plates.
So why is a new approach like this so desperately needed right now? Well, to really get it, we first need to zoom out and look at a pretty troubling trend that's been building for decades. It's a crisis that's hitting us on two major fronts.
Okay, so just take a look at this graph. It tells a pretty powerful story. You've got two lines here. Since 1980, the rates of metabolic problems, things like obesity and type 2 diabetes, have just been climbing and climbing. But look at the other line. Right alongside it, we see a nearly identical rise in severe mental illness. The fact that these two are moving in lockstep, practically holding hands, that's a huge clue that they're connected, and that whatever we're doing now just isn't working.
And this isn't just some random correlation. As cardiologist Dr. Brett Scher puts it pretty bluntly, our efforts haven't just stalled, the problem has actually been getting worse and worse. So the takeaway here is pretty clear. We desperately need a new way of thinking about this.
And that new way of thinking? It's called metabolic psychiatry. And it's a genuine shift in how we understand the human mind.
So what is it exactly? Well, at its core, metabolic psychiatry totally reframes mental illness. It suggests that things like depression or even schizophrenia might just be symptoms of a much deeper, body-wide metabolic problem. It's like if a light bulb is flickering. You wouldn't just keep changing the bulb, right? You'd check the wiring. This approach suggests we need to check the body's metabolic wiring to fix what's going on in the brain.
And this is the central idea. The mind and the body are one. Your brain is an incredibly energy-hungry organ. Its health depends completely on the health of its little power plants, the mitochondria. So this approach focuses on restoring the brain's fundamental health by going after things like insulin resistance and inflammation, using really powerful interventions like ketogenic therapy.
Okay, so all of this sounds great in theory, but does it actually work? I mean, what happens when the rubber meets the road? Let's look at a pretty remarkable case study where researchers put this exact idea to the test.
So here's the setup. A recent pilot study published in the journal Translational Psychiatry decided to tackle this head-on. They took a group of college students who were struggling with major depression, and for 12 weeks, they put them on a ketogenic diet. The goal was simple. Could this metabolic therapy actually change their mental health?
The results were, they were stunning. The students who finished the study saw an average of a 70% improvement in their depression symptoms. Let me just say that again, 70%. To give you some context, that is a massive, life-changing effect. It's way beyond what we typically see in drug trials. We're talking about students saying they felt like light was coming back into their life. Just incredible.
Now, of course, we have to be good scientists here. This was a small pilot study. It wasn't a giant, randomized controlled trial. But, and this is a huge but, its strengths are just impossible to ignore. First, the size of the effect is just tremendous. And get this, only one person dropped out because they didn't like the diet. The others left for normal life stuff, like moving. That's remarkable.
And that leads to this really cool idea called adherence as evidence. Just think about it. A ketogenic diet is tough, especially for a college student, right? So the fact that 2/3 of them stuck with it for 3 whole months is a powerful signal in itself. The only way that makes sense is if the benefits they were feeling, the improvements in their mood and their life, were so profound and so fast that they just blew past all the social costs and the hassle.
Okay, so this raises the huge question, right? How? How is this even possible? What on earth is going on biologically that could explain such a powerful effect from just changing what you eat?
Well, the key here is to stop thinking in terms of one drug, one target. This therapy isn't a silver bullet. It's more like a master key. It works by unlocking multiple connected pathways that all support a healthier brain. So let's break down a few of them.
First up, energy. In a lot of mental illnesses, the brain kind of loses its ability to use glucose for fuel. It's like a metabolic traffic jam. Ketones, which your body makes on a keto diet, are an amazing alternative fuel. They can just bypass that roadblock completely and deliver clean, efficient energy to those starving brain cells.
It also seems to rebalance the brain's main signaling system. It dials down the excitatory, kind of anxious signals from glutamate, and it boosts the calming, chill-out signals from GABA. At the very same time, it puts a damper on neuroinflammation, which we know is tightly linked to symptoms of depression.
And then there's the gut-brain axis. We hear about it all the time.
And this is a perfect example. What you eat directly feeds and changes your gut bacteria. Take this one compound, HVA. You can think of it as a feel-good messenger that your gut bacteria make for you. When your gut is happy, it sends plenty of HVA up to your brain. But get this, studies have found that people with depression often have super low levels of it. It's a direct physical link from your plate to your brain.
So let's zoom out again. What does all this mean for the future? This isn't just about a diet. This is about a movement that could totally reshape how we think about mental health care.
And this whole movement is being powered by something way more compelling than money. It's fueled by pure human passion. It's driven by philanthropists like the Bazooki family, who, after watching their own son suffer, dedicated themselves to finding better answers for everyone.
And what they're building is this community with a totally radical spirit of collaboration. Instead of competing, the top researchers in this field are getting together every single month to share data, talk through problems, and design better trials. It's this open, unified approach that's letting them make progress at a speed you almost never see in medicine.
And you can just feel the excitement from the experts who are doing this work. They see this not just as a new treatment, but as a chance to fundamentally change an entire field of medicine. And they see the incredible, life-altering impact it's already having.
And that leaves us with this one final, powerful question. For so long, we've treated the mind like it's disconnected from the body. But all of this new science is pointing to a deeper truth, that they are profoundly intertwined. And it suggests that maybe, just maybe, the future of mental health lies in healing our metabolism first.